Okay, so this will be my explanation about helminthic infections. And therefore, nowadays I'm gonna speak about a subject for parasitology. I am a student for clinical bacteriology. I have been studying in a public university in Bogota, Colombia. Nowadays, I'm gonna speak this kind of illness, parasitic illness, and also in worldwide there is a distribution of population risks factors in children also, due to predisposition, children between 1 year until 4 years old. Also, in adults, there is a predisposition of factor risk for parasitic infection. In worldwide, the Health World Organization said that in Asia, 73% of parasitic illness for Geohelminths, also in Europe and South America. In that, there is a risk factors, for example, to eat uncooked pork. In that, when you don't wash very well your vegetables, when you go into the bathroom and after that you don't wash very well your hands. In that, in people that walking in the environment with barefoot, there is could be risk factors for infection for wars. In that, I'm gonna tell you the epidemiology for Ascariasis lumbricoides and other sources of the tropical and subtropical areas around the world. And nowadays there is could be around 1 billion people we could be have that maybe have helminthic infection or parasitic infection, because last time I told you that there is could be predisposition of factors. Also, in that, poor sanitation are worse winters 25% of humans infected. Another for also this in that I'm gonna show you the cycle for Ascariasis lumbricoides. For the diagnosis for this disease is important to see first in the microscope. Yeah. Okay, after to see the microscope, is also extremely important to first to use some reagents, for example, Lugol. Also, in that, I forget to tell you that another kind of risk of factor for a parasitic infection illness are, for example, to eat uh, water. Uh, Contaminated water. This, as a result, you can have a parasitic illness for uncontaminated water. Also, in that, I wanna say now how to is the cycle for Ascaris lumbricoides. This work first, the larva uh, uh, inside of the body, trunks of the intestine, or after that could be go blow streamed into the lungs, attach larva into circulation and migrate to the lungs. Embryonic age with L3 larvae. These have a different stage, infective stage and diagnosis stage, and fertilized age, unfertilized age. Mm, in that, we can see in microscope this kind of wars in 40 H in microscope. In that, Ascariasis microides have a clinical presentation with early infection, usually asymptomatic, less commonly. There is also association with eosinophilic pneumonitis and infection in lung, and also there is a hypersensibility reaction in production for antibodies, for example, immediate immune response to larvae in lungs, and also another kinds of difference of clinical manifestations, chest pains, hemoptysis, among others. All in that, there is could be, for example, charcoal laden crystals, but this might be normal in a sample stool. For another hand, in the clinical presentation, again, often asymptomatic adults pass spontaneously for incidental during the colonoscopy. And also, you can see in the screenshot, in the picture, a photo about a medical process. The name is called to colonoscopy. You can see inside a work inside the intestine. For another hand, the complications of bowel blockages in very heavy infections, ectopic adults, migration to biliary tract. Also, there is might be another complications in another systems, gallstones, for example, and sepsis in the blood streams. There is could be infection for gram-negative rods, peritonitis, for example, and other sites. Make it the diagnosis is uh, important to first sample study microscope, colonoscopy, among others, kind of different kind of helpful diagnosis techniques that can be help the doctor for a screening for this illness. And finally, the treatment and prevention for this ascariasis of this kind of words for to kill the work is albendazole, mebendazole, and parental manage the complication surgery for the obstruction. This also have a key important role. Must have to be important. For another hand, in this, finally, you can see the summary for the most important key concepts for infection for, in this case, Ascaris lumbricoides, grain rounders, nematodes, wrongworms, earthworm, like adults, eight when granulation, transmission is fecal soil oral transmutation plus look migrations to the looks. In epidemiology, there is more prevalency in tropic and subtropical regions, and also there is predisposition in population, for example, children and adults, and reinfection. There is could be sometimes lower. This is a syndrome as a result infection for this kind of work or worse. In this case, Ascaris lumbricoides infection and or C in adults. Therapy, I told you in last 10 minutes that is albendazole, mebendazole, and primantel. In province sanitation is the key part for the prevention for this illness is a important in health public also. Trichuriasis and life cycle and hard work infection, for example, Ankylostoma duodenalis, will be explained my classmates, in this case, Hannah and Anna. For another hand, I'm going to tell you the consequence due to, as a result, of infection for a parasitic illness. In this case, there is, could be a risk factor for, in this case, for example, you can see in the first picture, weight loss. Yes, as a result, because on words could be to store your nutrients in your body. For another hand, there is could be less red blood cells in the blood. This is known as, for example, anemia. For another hand, some kind of words can be um, develop more risks for bladder cancer. For example, hard work, in this case, Ankylostoma duodenalis is an example. For another hand, the preparation, I told you that the most important part for the preparation for infection for worms is wash your hands. Yeah, it's extremely important. Wash your hands after going to the bathroom. For another hand, you need to first cook very well the pork, because there is could be more predisposition in some industries that don't cook very well the pork, or there is not control quality in some industries and companies for this pork. For example, infection for tenias, for example, tenia saginata, for example, or tenia solium. Yeah. For another hand, you need to wash to cook very well your vegetables, and wash very well your vegetables. And the good disposition for was waters, yeah, is extremely important. For another hand, to aid water contaminated could be give you a result, for example, another kind of illness, for example, cholera. Yeah, but in this case it's different because it's an illness with association with bacteria in this case. How to examine words in microscope? I told you that it is necessary to put the sample in a stool, in a microscope, and use some reagents, for example, Lugol. Uh-huh. And that's it. For another hand, you could be see in the microscope another kinds of different kind of things. For example, microorganisms, fungi, among others. And in that, white blood cells, red blood cells. Uh-huh. And you can see the most important part for diagnosis of illness is to a correlation with the clinical manifestation for the patient. And in conclusion, I told you few explanation about some helminthic infections. If you wanna have a more deeper knowledge, you will be check some websites for have a better you understand it for a subject. And that's it for everything. At the moment, I have been improve my skill in English. I try.